But often referred to as a lifestyle, the lifelong socioeconomic impact of diabetes on its victims is the reason why health experts continue to drum home the need for healthy lifestyle choices to reduce vulnerability by at least 90%, with risk factors including unhealthy diet, lack of physical activity, the use of tobacco, secondhand smoking, and excessive drinking of alcohol. Health complications arising from diabetes could go as far as causing blindness. As part of activities to mark World Diabetes Day last Saturday, surgeons at Agarwal Eye Hospital have been urging the public to be wary of their choices to avoid the disease.
The last assessment of the prevalence, that means the number of people who have diabetes worldwide, was estimated to be 468 million in all. And it's projected that in the next, 2030, it will be about 500,000. And even 2045, we're expecting something more than 700 million.
Senior eye surgeon at Agarwal Eye Hospital, Dr. Awisom Senaja, given a breakdown of the current and projected prevalence of diabetes across the globe. In Ghana, an estimated 1.8 million people, representing about 6% of the population, are living with one type of diabetes or the other. This is worrying, especially because more than half of the cases are undiagnosed.
Many people are walking on the street now who don't know they have the disease. Mortality rate in 2016 is about 1.6 million people who have died from diabetic-related diseases. And that alone went to 2.2 million in 2012.
Though the cause of diabetes could be genetic, it is generally considered a lifestyle disease.
And I always advise my patient, if you try not to put sugar in your tea and you eat the kenke or the rice, there may not be any difference because it will be broken down to sugar. That is one. Your diet is crucial. Then number two, physical activities. Of course, you need to burn it. This sugar accumulates in the blood because you have not used it. So if you use it, then of course, there will be less sugar circulating in the blood.
As one of the most prevalent non-communicable diseases, diabetes is a major risk factor for severe illness and mortality in patients. Besides being one of the non-communicable diseases contributing to 95% of all of Ghana's COVID-19 related deaths, the complications from diabetes extends to the eye.
The retina must have enough blood supply for it to be able to see. But when you have diabetes over a period, those blood vessels will close over time because the sugar will continue to coat on the blood vessel walls that carries the blood to the eye. And because the blood vessels are so small and tiny in the eye, they are more vulnerable.